Welcome to our medical assistant practice test. This test consists of 100 questions designed to help you prepare for your medical assistant certification exam. Each question includes an explanation of the correct answer, so you can understand the reasoning behind it. Whether you're just starting out in your medical assistant career or you're looking to refresh your knowledge, this practice test is a great way to get a feel for the types of questions you can expect on the actual exam. Let's get started. 1. The CPT code for a flu shot is A. 90658, B. 993.97, C. 1200, D. 542. Correct answer, A. 90658. A CPT code is a 5-digit numeric code that is used to code medical, surgical, imaging, laboratory, and therapeutic services of the physician. CPT refers to current procedural terminology. 2. The CPT code for an office visit is A. 88467, B. 44391, C. 12001, D. 99214. Correct answer, D. 99214. The CPT code for an office visit is 99,214. An office or outpatient visit for the evaluation and management of an established patient requires detailed history, physical examination, and medical decision-making of moderate complexity. 3. In ICD-10, Z codes are used to A. Refer to specific conditions, B. Refer to injury, C. Refer to factors that influence health status, D. Refer to external causes of injury. Correct answer, C. Refer to factors that influence health status. Z codes are codes that refer to factors that influence health status. It is important in reporting medical necessity. 4. Morphology of neoplasm is coded as A. M code, B. E code, C. Codes 110 to 799, D. Codes 960 to 989. Correct answer, A. M code. M codes code for morphology of neoplasms. The first 4 digits code for the histology of the neoplasm, and the 5th digit codes for the behavior of neoplasm. 5. Assets equals liabilities plus owner equity. Which accounting system uses this equation? A. Accounts receivable, B. Single entry, C. Daily log, D. Double entry. Correct answer, D. Double entry. The double entry system is based on this equation. This does require more extensive knowledge of accounting procedure than the single entry system. 6. The debt obligation of a business, A. Accounts receivable, B. Equity, C. Liability, D. Asset. Correct answer, C. Liability. A liability is the debt obligation of a business. It includes accounts payable and debts. 7. It is a one-write system in which all transactions for the day are recorded, A. Pegboard, B. Single entry, C. Double entry, D. Total practice. Correct answer, A. Pegboard. Pegboard system is the most common manual method used in the doctor's office. It uses a pegboard, day sheet, ledgers, and charge slips. 8. Which of the following is a form used in a medical office to reflect the professional services rendered during a patient visit? A. Ledger, B. Superbill, C. Point of service, D. Claim. Correct answer, B. Superbill. A superbill is a medical office form used to reflect the professional services rendered during a patient visit. It offers a standard way of itemizing diagnostic and therapeutic procedures used in a patient. 9. Which type of check is guaranteed that funds will be available upon redemption of the check? A. Cashier's check, B. Money order, C. Certified check, D. All of the above. Correct answer, D, all of the above. Cashier's check, money order and certified check guarantee that funds will be available upon redemption of the check. All three are secure payment methods. 10. A physician submitted a bill for surgery when he actually just treated an abrasion. This practice is referred to as phantom billing. B. Upcoding. C. Unbundling. D. Split billing. Correct answer, B. Upcoding. This practice is referred to as upcoding. Upcoding is a scheme to bill the insurance company for a higher price rate procedure. 11. A 7-year-old girl falls while riding her bicycle. She complains of scratches and small cuts on her skin. What type of wound does she have? A. Avulsion. B. Contusion. C. Abrasion. D. Laceration. Correct answer, C. Abrasion. An abrasion is the rubbing away or scraping of the skin surface by friction against another rough surface. Abrasions are superficial wounds, thus there is not much bleeding. 12. A 20-year-old man is brought to the emergency department with confusion and severe thirst. He is a known diabetic. He mentions that he ran out of insulin 3 days ago. His blood sugar is elevated at 450 mg per dl, and his urinalysis showed ketones. What is the most likely diagnosis of the patient? A. Hypoglycemia. B. Shock. C. Diabetic ketoacidosis. D. Diabetes insipidus. Correct answer, C. Diabetic ketoacidosis. Diabetic ketoacidosis or DKA is a severe diabetic complication that occurs when the body produces high levels of ketones in response to lack of enough insulin. Without insulin, glucose builds up in the blood. Since the body is unable to utilize sugar for energy, it breaks down fat instead. When this occurs, ketones are produced as an alternative source of fuel. 13. A 21-year-old patient came in complaining that he had been exposed to poison ivy. What initial step should be taken? A. Call 911. B. Rinse the affected area immediately with copious amount of water. C. Apply antibiotic cream right away. D. Call poison center and ask for antidote. Correct answer, B. Rinse the affected area immediately with copious amount of water. The initial treatment for someone who has recently been exposed to poison ivy includes rinsing the affected area with generous amounts of water to flush the resin. Cleaning the clothing that may have come into contact with the plant should be done next. 14. A new medical assistant was asked to check for the pulse of a 10-month-old baby. What pulse site should the medical assistant use to check for the pulse of this baby? A. Radial. B. Brachial. C. Carotid. D. Femoral. Correct answer, B. Brachial. The recommended pulse site to check for circulation in an infant is the brachial pulse. The brachial pulse is located in the inner aspect of the upper arm. 15. A 56-year-old man was brought to the emergency room because of chest pain. An ECG was done and a heart attack was ruled out. Angiography was done and the results showed 40% block in his coronary arteries. This condition is called myocardial infarction. B. Congestive heart failure. C. Myocardial ischemia. D. Cardiomegaly. Correct answer, C. Myocardial ischemia. Myocardial ischemia refers to an insufficient blood flow to the heart muscles, resulting in chest pain. If left untreated, it can result in a heart attack or myocardial infarction. 16. A child was brought to the emergency room because of burns from boiling water. The patient's whole left leg was burnt. What is the estimated percentage according to the rule of nines? A. 9%. B. 18%. C. 1%. D. 14%. Correct answer, D. 14%. According to the rule of nines, in a child, each lower extremity is 14%. Here are the proportions for the rest of the body: 9% for each arm, 18% for head, 18% for front torso, 18% for back torso, and 1% for the genitalia. 17. A 5-year-old boy was brought to the clinic because he fell on his right arm, injuring his elbow. The radiologist described the fracture as one side of the bone being bent and the other side broken. What type of fracture is this? A. Green stick fracture. B. Comminuted fracture. C. Impacted fracture. D. Spiral fracture. Correct answer: A. Green stick fracture. A green stick fracture occurs when a bone bends and cracks, instead of breaking completely into separate pieces. This type of broken bone most commonly occurs in children because their bones are softer and more flexible than adults. 18. The question, "What brings you to the clinic today?" addresses what part of the medical history? A. Chief complaint. B. Present illness. C. Past history. D. Social history. Correct answer: chief complaint. The chief complaint is the main reason for the patient's visit. 19. Antibiotic resistance is best prevented by: prescribe more than one antibiotic to the patient. B. Prolong the antibiotic treatment. C. Follow the recommended dose and duration of the antibiotic treatment. D. Increase the dose slightly higher to kill more bacteria. Correct answer: C. Follow the recommended dose and duration of the antibiotic treatment. Antibiotic resistance is best prevented by following the recommended dose and duration of the antibiotic treatment. Most resistance is due to incomplete treatment because of non-compliance of patients. 20. The patient was brought to the clinic because of headache, nausea, rash, and dizziness. Which of the following is an objective finding? A. Headache. B. Dizziness. C. Rash. D. Nausea. Correct answer: C. Rash. Rash is an objective finding. Objective data are information based on what the health provider observes, hears, smells, and feels. It also includes measurable information such as laboratory tests and the physical examination. 21. Which of the following is not a classification of hypertension? A. Essential hypertension. B. Secondary hypertension. C. Malignant hypertension. D. Benign hypertension. Correct answer: D. Benign hypertension. Hypertension can be classified as essential, secondary, and malignant. Benign hypertension is not a standard classification for hypertension. 22. During the patient interview, the patient reports that she has abdominal pain. What type of information did the patient report? A. Sign. B. Objective. C. Subjective. D. Impression. Correct answer: C. Subjective. Subjective data includes information about what the patient feels. Symptoms are considered subjective information such as abdominal pain. 23. A 10-year-old girl with red eyes was examined for pink eye. How is this disease transmitted? A. Staring at the eye of an infected patient. B. Touching objects or things contaminated with the virus. C. Sharing the same clothing. D. Through blood or food. Correct answer: B. Touching objects or things contaminated with the virus. Pink eye, conjunctivitis, is highly contagious. Most viruses that cause conjunctivitis are spread through hand-to-eye contact by hands or objects that are contaminated with the infectious virus. Hands can become contaminated by coming in contact with infectious tears, eye discharge, fecal matter, or respiratory discharges. 24. The medical assistant asked the patient, "You drink alcoholic beverages, right?" This question is an example of A. Leading question. B. Summarizing question. C. Clarifying question. D. Open-ended question. Correct answer, leading question. The question of the medical assistant is an example of a leading question. Leading question suggests the desired answer to the patient. A better way to pose this question would be, do you drink alcoholic beverages? 25. Which of the following is not recommended when interviewing a patient? A. Have eye contact. B. Look at the clock to prevent patient from rambling. C. Lean toward the patient. D. Nod when the patient talks. Correct answer, B. Look at the clock to prevent patient from rambling. The key to successful interviewing is aligning between verbal and nonverbal messages conveyed to the patient. Looking at the clock conveys to the patient inattention and disinterest. 26. A stroke patient is breathing with alternating periods of apnea and tachypnea. What is this breathing pattern called? A. Sturge-Weber. B. Prader-Willi. C. Shane-Stokes. D. Lou Gehrig. Correct answer, C. Shane-Stokes. Shane-Stokes respiration is an abnormal breathing pattern described as periods of tachypnea alternating with periods of apnea. The condition was named after two physicians who first described it in the 19th century, John Shane and William Stokes. 27. While interviewing the patient, you notice that the patient has involuntary, purposeless, non-rhythmic, abrupt movements that flow from one body part to another. The patient is manifesting what movement problem? A. Dystonia. B. Aphasia. C. Tremors. D. Chorea. Correct answer, D. Chorea. Chorea is an involuntary, purposeless, non-rhythmic, abrupt movement that flows from one body part to another. It is caused by damage to the caudate nucleus in the brain. 28. Which of the following is not a risk factor for heart disease? A. Diabetes. B. No immunizations. C. Inactivity. D. Hypertension. Correct answer, B. No immunizations. Risk factors for heart disease include the following: diabetes, smoking, high cholesterol, inactivity, family history, obesity, and hypertension. Immunization is not a risk factor for heart disease. 29. This information is not placed in the present illness section. A. Allergies of the patient. B. Timing of symptoms. C. Factors that relieve symptoms. D. Associated symptoms. Correct answer, A. Allergies of the patient. Allergies are placed on a separate section or as part of the past history. Questions to ask in the present illness section are timing, location, associated symptoms, aggravating, and relieving symptoms. 30. If the patient complains of chest pain and points that the pain is right behind the breastbone, how will this be documented? A. Left-sided chest pain. B. Parasternal pain. C. Substernal pain. D. Midclavicular pain. Correct answer, C. Substernal pain. Substernal pain is pain under the breastbone. It may indicate a cardiac origin, therefore, it must be further investigated. 31. Serious crimes such as homicide, rape, and arson fall into what classification? A. Misdemeanor. B. Infraction. C. Felony. D. Heinous. Correct answer, C. Felony. A felony is a serious crime punishable by a term in state or federal prison of more than 1 year. In contrast, a misdemeanor is only punishable by confinement to county or local jail for less than 1 year and/or the imposition of a fine. 32. A corporate manager decided to divert corporate money to some of his family members who are not employed with the company by adding them to the payroll. This is an example of A. Negligence. B. Breach of confidentiality. C. Splitting. D. Embezzlement. Correct answer, D. Embezzlement. The definition of embezzlement is the fraudulent conversion of another's property by a person who is in a position of trust, such as an agent or employee. It involves misappropriating funds or property for one's own benefit. 33. The intentional touching of, or application of force to the body of another person in a harmful manner. A. Assault. B. Battery. C. Fraud. D. Larceny. Correct answer, B. Battery. Battery is the unlawful touching or doing bodily harm without consent. Assault is the threat or the perceived threat of doing bodily harm by another person. Larceny is the unauthorized taking of the personal property of another by an individual who intends to permanently deprive the owner of it. Fraud is the intentional deception of a person or entity by another made for monetary or personal gain. 34. Which of the following is not included in the present illness history? A. Timing. B. Location. C. Allergies. D. Associated symptoms. Correct answer, C. Allergies. Information about patient allergies is not included in the history of present illness. It is part of the past history or in a separate allergy section. 35. When a file is removed from the system, this file supply is inserted to alert that the file is being used. A. Out guides. B. Labels. C. File guides. D. File cabinet. Correct answer, A. Out guides. Out guides are dividers of a different size and color than the file folders. Its purpose is to allow the medical office to identify the precise location of a file. 36. In alphabetic filing, which name should be filed first? A. Schultz, Vin. B. Schultz, Mary. C. Schultz, Dory. D. Schultz, Jerry. Correct answer, C. Schultz, Dory. In using alphabetic filing, if the first unit is similar, move on to the second and succeeding units until a difference is apparent. Since all last names are Schultz, the next unit that is different are the first names. Dory starts with a D, thus it comes before the rest of the first name letters. 37. Which name should come first in alphabetic filing? A. Kelly, James. B. Coley, Joe. C. Kelly, Jean. D. Coley, Joseph. Correct answer, D. Coley, Joseph. Coley, Joseph will be first in the filing. All these names start with KEL. The next letter determines the name that will be filed first. Since the next letter of Coley, from Kel, is E, it comes first from the rest of the first names, alphabetically. 38. The acronym SOMAR stands for Source-Oriented Medical Record. B. State of the Media Record. C. Standardized Outpatient Medical Record. D. Standard-Oriented Medical Record. Correct answer, Source-Oriented Medical Record. SOMAR refers to source-oriented medical records. Examples are progress notes, laboratory reports, imaging reports, and surgical reports. 39. The use of enzymes to carry molecules from a higher concentration to a lower concentration across a cell membrane. A. External respiration. B. Facilitated diffusion. C. Emulsification. D. Chemoreception. Correct answer, B. Facilitated diffusion. Some substances need to move from a place of higher concentration to a place of lower concentration, but cannot flow through a membrane. These substances need assistance known as facilitation. An example would be glucose, as glucose molecules cannot cross a cell membrane. 40. Anaerobic respiration causes this type of acid to build up in the muscle. Salicylic acid. B. Acetic acid. C. Citric acid. D. Lactic acid. Correct answer, D. Lactic acid. Lactic acid builds up in the muscle when glycolysis occurs without oxygen. During strenuous exercise, ATP production cannot always keep up with demand. Oxygen is used faster than it can be delivered to the cells, but the muscles still need to function even when all the oxygen stores are gone. 41. What is the term used to describe the action when muscles shorten to create movement? A. Opposition. B. Isometric contraction. C. Isotonic contraction. D. Supination. Correct answer, C. Isotonic contraction. Isotonic contractions cause the muscles to shorten to create movement. Some examples of this would be swimming, running, and lifting weights. This type of exercise also improves the tone, size, strength, and endurance of muscles. 42. The coiled tubule that sits on top of each testis, vas deferens. B. Spermatids. C. Fimbriae. D. Epididymis. Correct answer, D. Epididymis. Epididymis is the coiled tubule that sits on top of each testis. The epididymis is a temporary storage area for sperm. 43. The tube through which semen and urine leave the body in a male, prepuce. B. Urethra. C. Seminal vesicle. D. Bulbourethral. Correct answer, B. Urethra. Although the urethra is the tube through which semen and urine leave the male body, both never pass at the same time. When ejaculation occurs, the internal sphincter of the urinary bladder constricts so urine cannot leave the bladder and semen cannot enter. 44. This fluid contains fetal cells, A. Amniotic fluid. B. Prolactin. C. Parametrium. D. Luteinizing hormone. Correct answer, A. Amniotic fluid. Amniotic fluid contains fetal cells. Amniocentesis is a procedure in which a needle is inserted into the amnion, and a small amount of amniotic fluid is withdrawn. This fluid contains fetal cells that can be examined for genetic abnormalities. 45. When the uterus contracts and the cervix opens during the birth process, A. Expulsion. B. Dilation. C. Ovulation. D. Contraction. Correct answer, B. Dilation. Dilation occurs when the uterus contracts and the cervix opens. Birth, also called delivery, is initiated by the secretion of the hormone oxytocin, which stimulates uterine contractions and causes a thinning and widening of the cervix. When the cervix dilates to 10 decimeters, the fetus can move into the birth canal or vagina. 46. The middle ear contains A. Oval window. B. Organ of Corti. C. Tympanic membrane. D. Auricle. Correct answer, A. Oval window. The outer ear contains the auricle, external auditory canal, and tympanic membrane. The middle ear contains the malleus, incus, stapes, and the oval window. The inner ear contains the semicircular canals, cochlea, organ of Corti, hair cells, and the vestibulocochlear nerve. 47. A 35-year-old female with a history of asthma is complaining of shortness of breath when lying flat. The term for her symptom is A. Apnea. B. Tachypnea. C. Orthopnea. D. Bradypnea. Correct answer, C. Orthopnea. Orthopnea refers to difficulty of breathing or shortness of breath when lying flat. It came from the root word orth/o, which refers to straight or lying flat, and the suffix ni, which refers to breathing. 48. A surgeon asked the patient to point where in the abdominal quadrant is her pain. Which of the following is not a quadrant of the abdomen? A. RUQ. B. LLQ. C. LRQ. D. LUQ. Correct answer, C. LRQ. LRQ is not one of the four quadrants of the abdomen. The four quadrants are RUQ, LUQ, RLQ, and LLQ. 49. A 65-year-old male was brought to the emergency room for chest pain. The patient's diagnosis was a heart attack. What is the correct term for this symptom? A. Atherosclerosis. B. Angina. C. Tachycardia. D. Arrhythmia. Correct answer, B. Angina. The term for chest pain originating from a heart condition is angina. Angina is a type of chest pain caused by reduced blood flow to the heart muscle. 50. Which of the following is not one of the 9 regions of the abdomen? A. Epigastric. B. Hypogastric. C. Hypochondriac. D. Gastric. Correct answer, D. Gastric. Gastric is not one of the 9 regions of the abdomen. The 9 regions are epigastric, umbilical, hypogastric, right and left hypochondriac, right and left lumbar, and right and left iliac. 51. The patient underwent a procedure in which the surgeon removed fluid from the patient's right knee. What suffix would apply to this procedure? A. Tomy. B. Ostomy. C. Centesis. D. Ectomy. Correct answer, C. Centesis. The suffix centesis is a procedure that removes fluid from a body part. The procedure in the above case is an arthrocentesis of the right knee. 52. A 12-year-old boy fractured his calcaneus. Which bone did he actually fracture? A. Heel bone. B. Upper arm bone. C. Thigh bone. D. Wrist. Correct answer, A. Heel bone. Fracture of the calcaneus is a fracture of the heel bone. Calcaneus is the largest of the tarsal bones, and the largest bone of the foot. 53. A 17-year-old patient was brought to the office because of hematomas and bruises. The patient denies trauma and abuse. Which blood test will most likely be positive if it was a blood disorder? A. Hemoglobin. B. Partial thromboplastin time. PTT. C. Leukocyte count. D. Hematocrit. Correct answer, B. Partial thromboplastin time, PTT. Hematomas and bruising without a history of trauma or abuse is indicative of a bleeding disorder. Partial thromboplastin time, PTT, is used primarily to investigate unexplained bleeding or clotting. Abnormalities in hemoglobin, hematocrit and leukocyte do not generally result in hematomas and bruising. 54. A physician ordered a guaiac test for a patient who was complaining of abdominal pain. What is the indication for ordering such a test? A. To screen colon cancer. B. To screen lung cancer. C. To screen breast cancer. D. To screen prostate cancer. Correct answer, A. To screen colon cancer. Stool guaiac test detects blood in the stool. It is one of the most common form of FOBT, fecal occult blood test. It screens for colon cancer, polyps, tumors, angiodysplasia, diverticulitis, and inflammatory disease. 55. A diabetic patient denies that she is not compliant with her medications. Her blood sugar is elevated. What test should be done to determine the patient's average blood sugar for the past 3 months? A. Fasting blood sugar. B. Random blood sugar. C. Hemoglobin A1C. D. Postprandial sugar. Correct answer, C. Hemoglobin A1C. Hemoglobin A1C test is used to monitor treatment compliance in a diabetic patient. It measures the average blood sugar level of the patient for the past 3 months. 56. A 40-year-old obese female was seen in the office because of a right upper quadrant pain. If gallbladder stones are suspected, which diagnostic test would most likely be requested for this patient? A. Abdominal X-ray. B. Pyelogram. C. Abdominal ultrasound. D. Angiogram. Correct answer, C. Abdominal ultrasound. The recommended test for gallstones is an abdominal ultrasound or abdominal CT scan. Other further tests that can be requested are HITA scan, MRI, or ERCP. 57. The most accurate test to diagnose hypertension is through A. Heart angiogram, B. Heart echocardiogram, C. ECG, D. Sphygmomanometer and stethoscope. Correct answer, D. Sphygmomanometer and stethoscope. Hypertension is diagnosed by using a stethoscope and sphygmomanometer. To be accurate, 2 to 3 readings on different occasions that are high are required for the patient to be diagnosed as hypertensive. 58. Cholesterol and LDL measurement is recommended for healthy patients at what age? A. 35 for men, 45 for women. B. 35 for women, 45 for men. C. 45 for men, 55 for women. D. 45 for women, 55 for men. Correct answer, 35 for men, 45 for women. The recommended ages for testing cholesterol and LDL for men and women are 35 and 45. Lipid screening is recommended for all patients with diabetes, hypertension, CAD, and coronary equivalents. 59. Which of the following is not a coronary heart disease, CHD, equivalent? A. Abdominal aortic aneurysm. B. Diabetes. C. Peripheral vascular disease. D. Thrombophlebitis. Correct answer, D. Thrombophlebitis. Abdominal aortic aneurysm, diabetes, peripheral vascular disease and carotid artery disease are CHD equivalents. Thrombophlebitis is not considered a CHD equivalent. 60. If a woman asks at what age should she be screened by mammography for breast cancer, your answer should be A. 30. B. 35. C. 40. D. 50. Correct answer, C. 40. Mammography should be done starting at age 40, then every 2 years. As a screening test, only mammography is proven to lower mortality. 61. Which of the following is an output device? A. Monitor. B. Hard drive. C. Mouse. D. Scanner. Correct answer, F. Monitor. An output device is any piece of computer hardware used to communicate the data processing carried out by a computer which converts the electronically generated readable form. A monitor is an example of an output device. Hard drives, mice and scanners are input devices. 62. DVD refers to A. Driver and vehicle data. B. Driver's vigilance device. C. Dynamic voltage drop. D. Digital video disc. Correct answer, D. Digital video disc. DVD stands for digital video disc. DVD is a type of CD that is able to store large amounts of data. 63. Encryption is the translation of data into a code that is not readily understood by unauthorized users. This data is referred to as ciphertext. B. Binary. C. Electronic signature. D. Cookies. Correct answer, ciphertext. Encryption is the conversion of data into a form that cannot be understood by unauthorized people. This encrypted data is called ciphertext. Encryption is used to prevent unauthorized users from accessing information. 64. The acronym HTML refers to A. Hypertext Markup Language. B. High Temperature Monitor Layout. C. High Tensile Monitor Layout. D. Hotmail. Correct answer, A. Hypertext Markup Language. HTML stands for Hypertext Markup Language. It is a set of symbols or codes inserted in a file intended for display on the Internet. 65. Which of the following is not a common file format? A. .url. B. .gif. C.jpg. D.rtf. Correct answer. .url or Uniform Resource Locator is not a file format. It identifies the global address and domain to access web pages. GIG, JPEG, and RTF are examples of file formats. 66. The acronym DSL stands for Direct Subscriber Line. B. Data Set Label. C. Dynamic Simulation Language. D. Direct Satellite Link. Correct answer, Direct Subscriber Line. DSL refers to Direct Subscriber Line. DSL is a high-speed connection that is used to provide internet access by transmitting digital data over telephone lines. 67. Which domain extension is used by Harvard University? A. .net. B. .edu. C. .org. D. .gov. Correct answer, B. .edu. The .edu domain is one of the top-level subdivisions of the Internet Domain Name System, DNS. The .edu domain is intended for accredited post-secondary educational U.S. institutions. 68. A numerical label assigned to each computer participating in a computer network that uses the Internet Protocol for communication. A. HTTP address. B. URL address. C. IP address. D. Domain name. Correct answer, C. IP address. IP address is a number label assigned to computers in a network that uses the Internet Protocol for communication. Every computer has a unique identifier called the IP address. 69. Which of the following is not considered a web browser? A. Internet Explorer. B. Yahoo. C. Google. D. Windows. Correct answer, D. Windows. Windows is a computer operating system, not a web browser. A browser is a software that is used to access the Internet. Examples of web browsers are Yahoo, Google, and Internet Explorer. 70. The amount of information that can be sent over a connection at one time, or how many bits can be processed in a single instruction. Clock speed. B. Bandwidth. C. Instruction set. D. Network. Correct answer, B. Bandwidth. Bandwidth is the amount of information that can be sent over a connection at one time or how many bits can be processed in a single instruction. Bandwidth is usually expressed in bits per second. 71. A patient complained of chest pain, diaphoresis, and anxiety. The patient was diagnosed with coronary artery disease. The lipid that is most likely linked to it is A. LDL. B. HDL. C. Polyunsaturated fats. D. Triglycerides. Correct answer, A. LDL. Cholesterol is found mainly in animal foods. There are two types of cholesterol, HDL and LDL. Low-density lipoprotein, LDL, is called bad cholesterol because it promotes fatty plaques causing atherosclerosis of coronary artery disease. 72. A patient was brought to the emergency room because of sudden sharp pain and swelling of the big toe. The patient has a history of gout. What is the recommended diet for this patient? A. Low salt. B. Low sugar. C. Less meat. D. High fiber. Correct answer, C. Less meat. Gout is one of the most painful types of arthritis. It occurs when too much uric acid accumulates in the body. The increase in uric acid leads to crystal deposits in joints, often in the big toe, under the skin, or uric acid stones in the kidney. Recommended diet is to limit intake of foods high in purines, such as red meat, organ meats, and limiting alcoholic beverages. 73. A patient was complaining of weakness, fatigue, constipation, and muscle cramping. Blood tests reveal hypokalemia. What is the treatment for this condition? A. Iron. B. Calcium. C. Potassium. D. Transfusion. Correct answer, C. Potassium. Low potassium level is referred to as hypokalemia. Taking potassium supplements can usually reverse this condition. In severe cases, without proper treatment, it can lead to serious heart rhythm problems. 74. As food goes down through the digestive tract, nutrients are transferred to the bloodstream. This process is referred as A. Digestion. B. Ingestion. C. Metabolism. D. Absorption. Correct answer, D. Absorption. The four functions of the digestive system are ingestion, digestion, absorption, and elimination. Absorption is the process where nutrients are transferred to the bloodstream. 75. If the patient ingested 10 grams of fat, how much calories did he actually eat? A. 40. B. 70. C. 80. D. 90. Correct answer, D. 90. 1 gram of fat is equivalent to 9 calories. Eating 10 grams of fat would be the equivalent of 90 calories. 76. Which of the following is a fat-soluble vitamin? A. Cyanocobalamin. B. Niacin. C. Retinoic acid. D. Folic acid. Correct answer, C. Retinoic acid. Retinoic acid is the common name of vitamin A. It is one of the fat-soluble vitamins. There are 4 fat-soluble vitamins, vitamins A, D, E, K. 77. The vaccine DTaP refers to A. Diphtheria, tuberculosis, pertussis vaccine. B. Diabetes, tetanus, pneumonia. C. Diphtheria, tetanus, pertussis vaccine. D. Diabetes, tuberculosis, pneumonia vaccine. Correct answer, C. Diphtheria, tetanus, pertussis vaccine. The DTaP vaccine protects the child against 3 diseases, diphtheria, tetanus, and pertussis. Children should get 5 doses before age 7. These doses are administered at ages 2, 4, 6, and 15 to 18 months, and 4 to 6 years of age. The 4th dose may be given as early as 12 months of age. 78. The physician wrote on the prescription, take penicillin 1 tablet QID. The abbreviation QID means A. 2 times a day. B. 3 times a day. C. 4 times a day. D. Orally. Correct answer, C. 4 times a day. The abbreviation QID refers to 4 times a day. The abbreviation QID or QID is also sometimes written as QID. 79. The pharmacist should look for which number on the prescription to determine if the prescriber is licensed to prescribe controlled substances. A. DA number. B. Medical license number. C. Prescription number. D. PRI number. Correct answer, F. DEA number. DEA number is a number assigned to a healthcare provider by the U.S. Drug Enforcement Administration, DEA, allowing them to write prescriptions for controlled substances. The DEA number is encoded by 2 alphabetical letters followed by a 7-digit number. 80. A 52-year-old male is requesting medication for his erectile dysfunction. Which medications would most likely be prescribed by a physician? A. Sildenafil. B. Gabapentin. C. Azithromycin. D. Simvastatin. Correct answer, Sildenafil. Sildenafil is the generic name of Viagra. It relaxes smooth muscles and increases blood flow to the penis. Sildenafil is used to treat erectile dysfunction, impotence, in men. 81. Drugs of abuse such as heroin and cocaine are classified under what drug schedule? A. Schedule 1, B. Schedule 2. C. Schedule 3. D. Schedule 4. Correct answer, Schedule 1. According to the U.S. Drug Enforcement Administration, Schedule I drugs are drugs with no currently accepted medical use, and with a high potential for abuse. Schedule I drugs are the most dangerous drugs of all the drug schedules with potentially severe psychological or physical dependence. 82. A patient was rushed to the hospital because of severe high blood pressure. Which route of drug administration is recommended so that the medication given is instantaneous and complete? A. Intradermal. B. Intravenous. C. Intramuscular. D. Intraarterial. Correct answer, B. Intravenous. For the intravenous route, a needle is inserted directly into a vein. When given intravenously, a drug is delivered immediately to the bloodstream, and takes effect faster than by any other route. 83. What drug is contraindicated if the patient has a bleeding disorder? A. Anticoagulants. B. Diuretics. C. Anticonvulsants. D. Antihypertensives. Correct answer, A. Anticoagulants. Anticoagulants are also known as blood thinners. Anticoagulants are generally contraindicated in patients with bleeding conditions or disorders. 84. The generic drug fluoxetine is also known as Prozac. It is indicated for which disorder? A. Erectile dysfunction. B. Diabetes. C. Schizophrenia. D. Depression. Correct answer, D. Depression. Prozac, fluoxetine, is a selective serotonin reuptake inhibitors, SSRI, antidepressant. It is also used for panic disorders, anxiety disorders, and obsessive-compulsive disorders. 85. Which of the following is not a recommended site for IM injections? A. Deltoid. B. Abdomen. C. Vastus lateralis. D. Gluteus maximus. Correct answer, B. Abdomen. The abdomen is not a recommended site for an IM injection. The common sites are deltoid, vastus lateralis, and gluteus maximus. 86. The route of medication administration that goes to the fatty layer is A. Intramuscular. B. Subcutaneous. C. Intradermal. D. Intralipid. Correct answer, B. Subcutaneous. Subcutaneous, SC, injection is given in the fatty layer just beneath skin. The SC injection is generally absorbed more slowly. Some medications that can be injected subcutaneously are growth hormone and insulin. 87. The hierarchy of needs was proposed by which of the following psychology researchers? A. Maslow. B. Freud. C. Erikson. D. Skinner. Correct answer, F. Maslow. Abraham Maslow is credited with defining the hierarchy of need. The hierarchy of needs are ranked in order to include physiological needs, safety and security, love and belonging, esteem and recognition, and finally self-actualization. In order to progress from one level to the next, subjects must satisfy the current need. 88. Which of the following scenarios accurately describes self-actualization? A. Finding belongingness to a group. B. Recognizing one's worth to society. C. Feeling safe in one's environment. D. Reaching one's full potential. Correct answer, D. Reaching one's full potential. Self-actualization is the final stage in the hierarchy of needs by Maslow. This stage defines reaching a person's highest potential and can vary greatly from person to person. 89. According to life's 8 development stages, trust and mistrust are most likely experienced shortly after birth. B. The pre-teen years. C. Middle age. D. Old age. Correct answer, shortly after birth. Erik Erikson defined psychosocial development based on 8 stages ranging from birth to death. Each stage defines an ongoing pattern of psychosocial growth. In order of appearance, the 8 stages are trust versus mistrust, autonomy versus shame and doubt, initiative versus guilt, industry versus inferiority, identity versus role confusion, intimacy versus isolation, generativity versus stagnation, and ego integrity versus despair. 90. Classical conditioning is demonstrated in which of the following examples? A. A child starts crying upon mention of going to the doctor. B. A dog barks when seeing a stranger. C. A patient is startled when a medical assistant quickly opens a door without announcing his presence. D. A baby boy urinates every time his diaper is removed to be changed. Correct answer: A. A child starts crying upon mention of going to the doctor. Classical conditioning was described by Pavlov in a famous experiment involving a bell and a salivating dog. This theory of learning is based on obtaining a desired reaction based on giving rewards. Just as Pavlov was able to stimulate a dog to salivate by ringing a bell, children can be conditioned to associate pain with a visit to the doctor. From remembering previous visits that were unpleasant, such as receiving injections, children will start to associate the doctor with pain. 91. B.F. Skinner is regarded as being the primary researcher for which learning method? A. Classical conditioning. B. Operant conditioning. C. Trial and error. D. Kinesthetic learning principle. Correct answer: B. Operant conditioning. Operant conditioning explores the relationship of obtaining a desired outcome with both rewards and punishment. B.F. Skinner is famed for using the Skinner box, which used a controversial method of studying operant conditioning. 92. Holding a negative opinion or bias regarding a person because of the person's affiliation with a specific group. Projection. B. Prejudice. C. Persecute. D. Prosecute. Correct answer: B. Prejudice. Prejudice is an unfair feeling of dislike for a person or group based solely on the individual's membership in a social group. Prejudice can be based on various factors: sex, race, age, nationality, socioeconomic status, or religion. 93. The body's reaction to stress is A. Fight or flight. B. Denial. C. Anger. D. Acceptance. Correct answer: A. Fight or flight. This combination of reactions to stress is also termed as the fight or flight response. It enables people to adapt quickly to life-threatening situations. 94. A baby rolls over and sits up. What is the stage of growth and development of this baby? A. 0 to 3 months. B. 4 to 7 months. C. 8 to 12 months. D. 13 to 18 months. Correct answer: B. 4 to 7 months. At age 4 to 7 months, the infant can roll over and sit up. The infant can also grasp objects and has good eye coordination. 95. The professional organization for the field of effective management of health data and medical records is A. AMA. B. AHIMA. C. OSHA. D. HAPA. Correct answer: B. AHIMA. AHIMA refers to American Health Information Management Association. It is the professional organization for the field of effective management of health data and medical records. AHIMA's primary goal is to provide the knowledge, resources, and tools to advance health information professional practice and standards for the delivery of quality healthcare. 96. When supplies are delivered to the office, a medical assistant accepting the delivery should A. Place the supplies in storage. B. Check the supplies with the packing slip. C. Get the physician. D. Open it when you find free time to check it. Correct answer: B. Check the supplies with the packing slip. When a new supply delivery arrives, the first step is to check the packing slip against the supplies to make sure that the delivery was accurate. This prevents misunderstanding between the deliverer and the facility. 97. Federal Insurance Contribution Act, FICA, Funds are paid into Social Security. Who pays into the FICA fund? A. The employee only. B. The employer only. C. The employee only if the employer has fewer than 20 employees. D. The employer and the employee each pay half of what is due. Correct answer: D. The employer and the employee each pay half of what is due. The employee pays half and the employer pays the other half of these taxes. The taxes are applied based on the level of taxable earnings, the length of the payroll period, marital status, and the number of withholding allowances claimed. 98. Voucher checks are commonly used for A. Insurance payments. B. Payroll. C. Cash converted to foreign currency. D. To obtain petty cash. Correct answer: B. Payroll. A voucher check allows additional information such as deductions to be on the check for the employee's information. These checks are commonly used for payroll. Even if the check is directly deposited, the employee will receive a copy of the voucher check. 99. Which of the following is a method to track incoming telephone calls so that all messages are taken care of? A. Answer every incoming call. B. Making a telephone log. C. Install voice messaging. D. Discard not important calls. Correct answer: B. Making a telephone log. Tracking incoming telephone calls and messages are vital to the operation of an office. A good way of tracking all incoming calls and messages is to create a telephone log. 100. Which of the following is not usually used when making appointment reminders for the patient? A. Calling the patient directly. B. Reminder card before leaving the office. C. Sending patients postcards. D. Sending appointment letter by fax. Correct answer: D. Sending appointment letter by fax. Doctors' clinics send appointment reminders in different ways. They give a reminder card before the patient leaves the office, call the patient directly, or they can send postcards. Fax transmissions are not typically used. Congratulations! You have completed the test. Don't forget to like this video and subscribe to our channel for more resources.